arthritis is an autoimmune disorder, which means that the body's protective cells, they attack the body's own cells. So what happens because of this is the symptoms that you get are you may get swelling and stiffness and pain in multiple joints in the body, especially the small joints in the fingers and the toes, but it can also affect the larger joints like the knees and the hips. The pain which you get usually is seasonal. It's not constant throughout the year. Some few months you may be having a lot of pain, few months you may not be having that much of pain. So it kind of waxes and wanes. The next thing is usually the symptoms start to appear in a younger age group from the age of 20, 30 onwards. It is a familial thing, it is genetic, so if your parents do have rheumatoid arthritis, there is a chance that you may get it too. In very, very severe cases, it may affect the knees and hips to such an extent that you may be even wheelchair bound. Of course, that is in very severe cases. How do you diagnose rheumatoid arthritis? There is a test known as rheumatoid arthritis factor, which will let us know if you are positive. If you are positive, it will let us know that you have arthritis, rheumatoid arthritis. The difference between rheumatoid arthritis and osteoarthritis. Osteoarthritis is an age-related wear and tear of the joints, especially the knee joints. So usually that sets in after the age of 50. But rheumatoid arthritis, the cells are attacking the joints at an earlier age, so you may get the same joint pains at a much earlier age, even at the age of 20 and 30 in very severe stages. How do you treat rheumatoid arthritis? As I said, this is a condition which waxes and wanes. The pain, swelling and stiffness is not constant. When it does flare up, there are some medications to take. The proper person to treat this is a rheumatologist. Okay, a rheumatologist will prescribe you medicines known as DMARDs, that is disease-modifying anti-rheumatoid drugs. And these should be taken. You have to constantly keep reviewing with them to see if your dosage has to be changed. In severe cases, even steroids may be required. Severe cases where the knee joints and the hip joints have been completely destroyed because of this disease process, those people may even require replacement surgeries, knee replacement or hip replacement. That's when the orthopedic surgeon comes into the picture. So rheumatoid arthritis is a condition which can be debilitating, but if you take the right treatment from the right people, you will be able to live with this without much problem.